At Plan International, we have a very bold strategic objective of ending teenage pregnancy and all sorts of violence against girls. It's a very bold objective that we are trying to work with. And we have chosen this based on the context and the work that we do, and also informed by our global priority, where we seek for a world that advances the right of the children and equality for girls. So all our projects, all our policy, all our partners are informed by this. And in order to help us deliver this strategic objective, we have 4 core program areas where we work in. The first one is sexual reproductive health and rights. And the second one is prevention and responding to gender-based violence and all sorts of discrimination. And then another one is protecting girls and young children in crisis. This is where our emergency work come in. And then the big one is around youth-led climate change adaptation, and then also creating green job and innovation. This is the key area where we work in. Now, since Plan started its work in Kenya in 1982, we have been working with community, delivering community-based approach, where the community are at the center of leading all our intervention, and we listen to them as we do our work. But now let me address this question: why are we here? I know in Kenya there's quite a lot of progress in terms of policy and working toward addressing gender equality, but still the gap still exists a lot, especially when you look at climate effect, whether drought or flooding. The group that are disproportionately affected are women and children. This is where you see the spike in forced early child marriages. You see girls dropping out of school. You also see child labor, and then also harmful practices like FGM sparking up, and that one has negative impact on women. And then also looking at the issue of poverty and equal power dynamic, and then limited access to education, and then inclusiveness. It aims to strengthen the ecosystem that prioritizes the health and the well-being of everyone, especially women, the young girls, men, boys, and those who are affected by gender-based violence. And what is our approach in this program? In Plan, we have what is called locally led, globally connected, where we work with the institution, indigenous institution, the local institution. That's why in this project we are working with 10 women group who will be leading this project, will be leading the intervention, and we'll only be there to facilitate them. And therefore, we need to support them so that they can work together with government, the law enforcement, the judiciary, the faith-based organization, and then the community. And then this project, briefly, what it aims to achieve is, one of them is promoting protective and inclusive environment that is protective, strengthening the referral pathways. I know very many agents are working on that. And then also ensuring access to medical, psychosocial support and legal support system, and also influencing policy, budget, and then also look at the system that can bring lasting protection.
It's a program that is taking place not only in Kenya, but also in Ethiopia and in Somalia. And what we aspire is that not only the women-led organizations that are here in Isiolo can connect, but also can connect with the ones in Ethiopia and in Somalia, and we can create one big alliance of powerful women working on GBV. So why is it that 50% of the population is not equal? I would like to thank Plan International actually for taking up that challenge, to working on it. And yesterday we were witnessing, talking to the women-led organizations here already, all that work that is done in the communities. You are amazing. And what we try to do with Plan is supporting you, strengthening you, so you can do your work even better and change lives. and challenging the authorities that are here. We had a discussion earlier today, be the commissioner at national level or the county. You are the custodians, you are the ones who can make this happen. So I take it as a commitment of all of you that you will support the program and make it happen. 46% of women in Isiolo apparently have witnessed GBV in one way or the other. 66% have undergone FGM. I would like all of us just to have a little look on the left and on the right. This means that every second woman being here has suffered of GBV. It is the sisters, it's your mothers, it's your daughters, it's ourselves. So I think it's important to put a face on what we try to do. These are not only statistics. One important factor, and some of my previous speakers have said it, is also that shame that comes with it. How is it that a survivor doesn't feel comfortable to come forward, to talk about it and get support? That is the problem, right? We should applaud all these brave women and girls, and we should enable them to be free and safe to speak, because it's only when we speak up that we can change things. If we keep it silent, nothing is going to change. So I encourage all of us to speak up. But Kenya has a very, very strong foundation, and again, I think there's a lot of legal foundations, and I will not enumerate them again as my predecessors have done them, but just one, for example, Sexual Offence Act or the FGM Prohibition Act. The tools are there. It's about making it happen now, and I think that's what we are here for.
Isiolo Gender Watch is working around women's rights, making sure that women amplify their voices so that they will, at the end of the day, they will just protect themselves. What we do is also policy advocacy to make sure that we have stronger policies, and we also hold the county government accountable because they are the ones who are supposed to give us the policies. We do governance issues because our people do not understand even the governance systems. So what we do is making sure that the communities know their rights, and the communities know how they will demand their rights in a positive way, not in a negative way. What else we do is also revitalizing the culture, especially our cultures. We are losing our culture. So for us, we are revitalizing and also making sure that we do intergenerational dialogues within the elders and the young boys, so that at least they will stay and use culture as a way of communication and as a way of life.
Indigenous women movement that champions the rights of women and girls in indigenous communities in the entire country. We focus on pastoralist communities, fisher folks, persons living with disabilities, young girls, adolescent girls, just to make sure that each and every voice of this group of women is well articulated and well spoken about, and that their issues are uniquely addressed. So Plan International is also welcomed if Indigenous women are also part of, because we are working in Isiolo, of course Indigenous women are part of in Isiolo County. So they are also invited to join the Indigenous Women Council, because we are growing. At this point, we are also going to East African level, just to bring also other voices of indigenous women from Uganda, like the Karamojong. In Tanzania, we have the Maasai in Tanzania. So we are growing and expanding the Indigenous Women Council, and every indigenous woman is welcomed to be part of the council.
As this group that you see here, through working closely with guidance from the national government and the county government Department of Gender, we have been able to achieve several milestones. And I'll start with strengthening the coordination forum. I know now as Isiolo County, we have a vibrant gender technical working group, and through guidance from the county government gender department and national government through National Gender Equality Commission, we're able to come up with a TOR, or terms of reference, that guides the implementation, that guides the coordination efforts in the county, and also establish different subsectors within the gender technical working group. I cannot fail to mention the policy environment. We know Isiolo County currently has a gender policy that through the support from the county, the national government, and the technical working group. It was operationalized, and recently, with a lot of effort and support, technically, financially, and morally, from this group, we were able to conduct a comprehensive gender equality and social inclusion analysis in the county that will inform future programming. I will not forget to mention a lot of grassroots mobilization and interventions that are currently ongoing. Through this technical working group, we're able to spread the resources to ensure that there is no duplication of efforts, and that we're able to reach the relevant sectors or cohorts or the regions. Finally, I cannot say that we still don't have gaps, because if I see there are no gaps, or if I see we have done a lot, and you go to the just released, not just released, it was released sometimes back, Kenya Demographic and Health Service, you'll see quite a number of gaps in that report. But I can say one of the areas that we are still struggling with, I'll say about the legal framework or legal environment, policy and legal environment. One of them being the gender bill that we're still struggling to work on. The GBV policy we are still working on. The GBV bill, sorry, the GBV bill. Then there's the child protection and safe houses bill. And also establishment of a safe house, and as Grace mentioned, having a one-stop shop for access to health services, psychosocial support, and other services for GBV survivors.
Huu mradi tunataka uwe mashinani pale. Miradi ya wanawake ambao imeongozwa na wanawake kwa kuwe ndio wa kwanza kuangalia ni nini ambalo laweza fanywa huko mashinani, ndio tumalizane na hili janga la GBV. Lile ambalo tumeona hapa kwa county ya Isiolo ni kwamba there is ile tunaita conspiracy of silence, ambapo kesi mingi hazifiki kwa vifaa vyetu ama asasi zetu za usalama, hazifikii polisi, zinamaliziliziwa pale. Na hili tunaweza kwanza kusema labda ni mambo ya kidini ama mambo ya culture ambao iko hapa, ambao kuna hii masla. But kwa hiki kikao cha leo, ile kitu ambao tumesema ni kwamba some of these cases, kesi ya defilement, hauwezi fanya alternative dispute resolution mechanism. Lazima asasi zetu za kiusalama zifikiwe na huu ujumbe ndio waweze kuchukua hatua. Kuna jambo lingine ambao limesema about rescue centers. Kuna mfano mmoja ambao tumepatiwa na Deputy County Commissioner wa mtoto mmoja ambaye alinajisiwa, akapata mimba, akazaa na akafukuzwa kwao nyumbani. Kwa county ya Isiolo hatuna hizo rescue centers ambapo angeenda. Bahati mzuri yeye alichukuliwa na familia ambao anakaa ndio aweze kutunza mtoto wake as she looks for other support. County wameweza kutuelezea kwamba in their development plan they are trying to set up those rescue centers, but with support of partners like the Swiss government and others, probably will support so that these cases can be supported at the local level. As a commission, our commitment is to work with the partners because we've realized that there are a lot of cases, unlike other counties across the country, is that Isiolo, the cases go unreported, most of them, majority of them, because we've been, not just here in Burat and Garemala, we went to Kina, and we've realized that, they avoid, they feel it's shameful to report some of these cases. But this project that Plan International is carrying out, number one is to remove that veil of shame. And your familia wajue that you can report these cases and interventions happen, because all these are issues around human dignity. When a young girl is defiled, you interfere with their future. You interfere with what happens in their later life, the families that they're going to raise. When violence is visited upon a family, what happens is that kids don't go to school, these women don't get engaged in productive economic activity, and families suffer. And that's why essentially we are looking at this intervention, because one, in the long term, if we succeed in Burat and Garemala, is that it can be scaled up with support of other partners, and we create a GBV-free society, and that's our goal.
GBV issues is not confined to only FGM. There are so many and requires a lot of attention and resources to create more awareness. We also appreciate Plan International because they have selected 10 organizations that are very competent, and we are looking forward to them implementing this activity within these 2 wards that have been identified. As a county, ours is, because I don't want to also preempt, because we'll be having other representative from the county led by the CC will be giving their remarks. We'll be giving a neighboring environment and fostering collaboration with the partners to complement what it is that we do as a county, and to actualize that we have in the area of policy and legal framework, we have tried as a county to come up with a relevant piece of legislation, like it was mentioned by earlier speakers. We have gender policy that is already in implementation. We have child protection policy because GBV issues is cross-cutting. It affects mostly children, as it equally affects also other gender. We have social protection policy, which mainly will be giving economic empowerment to these special interest groups. We are working on finalizing 2 pieces of legislation, that is disability policy and anti-FGM policy, which is spearheaded by the county and ActionAid.
To address GBV risks in Kenya, Somalia, and Ethiopia. And at the heart of this implementation is we have this women-led organization, WLOs. You have seen before 10 women-led organization representatives from Isiolo who are playing a vital role in the implementation project. And we have also similarly 10 women-led organizations in Somali region of Ethiopia and another 12 in Somalia and Somaliland. And totally we have 32 women-led organizations playing, leading and owning this Horn of Africa project for preventing and responding to the risk of GBV. So our main activities are strengthening the referral system mechanisms so that the different services like psychosocial support, mental health support, economic support, and everything will be delivered through collaborating with diverse stakeholders and partners. As you have already seen, we have the GBV coordination platform here in Isiolo. We have also similarly in Ethiopia and Somalia, and we collaborate with the GBV coordination platform in order to bring a comprehensive and integrated services for GBV survivors, so that we can help them to live, as I said, a dignified and to ensure their well-being. So Plan International is very excited to work with the government stakeholders, and we really thank you so much, the county government here in Isiolo, providing all kind of support for implementation of the project, particularly during the inception phase from July to December 2024, where we have implemented and some foundational works like selection of women-led organizations, conducting gender analysis, service mapping, and also baseline survey, and particularly participatory institutional support for women-led organizations.
Today's launch marks a broad and necessary step towards prevention, protection, and justice for survivors of GBV in Isiolo. It signals a shift from silence and stigma to collaboration, awareness, and action. The issue of partners, I sincerely thank Plan International for implementing this impactful program and the government of Switzerland through the Swiss Development Corporation for this generous financial support. Your investment demonstrates not only solidarity with the survivors, but also trust in the local solutions. I also salute the women-led organization who contribute invaluable knowledge, local knowledge, trust, and direct engagement with the different communities. Their collaboration ensures that solutions are context-specific, sustainable, and truly empowering to survivors. To the county government, as the county government of Isiolo, we reaffirm our zero tolerance on all forms of gender-based violence and remain committed to working hand in hand with our partners to ensure that survivors receive timely medical care, psychological support, legal redress, and the integration support. As a government, we are committed to creating an environment where all individuals, especially women and girls, can live free from fear and harm. We will also strengthen our community structures, support the operationalization of gender-based violence-related policies, and prioritize prevention in our development agenda. To the community must remember to fight. The fight against GVM remains with us, within our homes, our cultures, our schools, and our beliefs. So it is here with us, and it is us to give it to give it all the support so that we can be able to prevent this this monster.
What promotes GBV is the fact that those who hold resources in the family are mainly men. And when you are in control of resources, you can easily abuse the others. So in this case, we need to empower women and girls so that at least they are also able to access resources. And I appreciate those who have, especially the dancers who are here, when they were calling on those ones who perpetrate that watafungwa maisha. Now, hii kufungwa maisha ni swala ambayo ingekuwa muhimu sana kama wangekuwa wanapatikana. Now we have the challenge where these cases happen in communities, but they go unreported. Many cases of GBV embedded in the communities, and no people come forward to raise complaints, because we have laws which deal with cases of gender-based violence. But however, reporting or communities coming out to volunteer information and give evidence, because you have to have witnesses who are willing to come forward and record statements for successful prosecution. So the reason as to why we have these cases which go unpunished is because no one is willing to volunteer information in the first case, and also to take a step further to record statements and be able to appear in court to give evidence. So we welcome partners who come forward so that we sensitize the communities, so that they are also aware of this, because some of the community members, especially deep in the interior, are not aware that these are cases which are punishable. They tolerate cases of violence against women because they think it is part of way of life. And it is a serious challenge among these communities, especially nowadays, in these situations where especially men control resources, and sometimes they use it wrongly. We've had cases of girls being molested, and sometimes even we have defilement cases. Sometimes these cases are very traumatizing, especially where young girls are involved. Very young girls are defiled, and they end up suffering. Some of them even get to, like a case I witnessed this week in the office, a young girl with urinary incontinence occasioned by someone who defiled the young girl. It is very saddening. And sometimes we have bottlenecks towards successful prosecution because sometimes evidence along the way is destroyed, and therefore you cannot successfully punish these cases, and that is why they continue happening. So it is important that we work together to ensure that we have overall security of the communities. And some of the predisposing factors of gender-based violence include drug and substance abuse. We are continuing to address the challenge of insecurity, such that tomorrow we've had the CS in the recent past coming, and even tomorrow tuko na ile chukua la usalama. Cabinet Secretary for Interior is coming to help us to address the challenge of insecurity. We are fortunate because we've empowered communities to confront cases of insecurity by giving them opportunities to engage the NPRs, National Police Reservists. And we are going to go an extra mile to add more where there are gaps. Mahali kuna upungufu wa National Police Reservists tutaongeza, na wale ambao pengine wamepotea ama hawafanyi hiyo kazi tutawaondoa, tutachuja hawa. We'll do the vetting and remove those ones who are inactive or they don't do the work appropriately, and then also engage new ones. So tutatembea kila mahali. We will go to every location to ensure that we do proper vetting and weeding out those ones who are unsuitable, so that at least when we assure the communities in Isiolo of their security, then even cases of GBV can easily quietly disappear.
And we'll be working in Burat as an Horn of Africa Institute, and our major activities that we're going to do within the project is response, especially in terms of GBV, amplifying the voices of women, and also establishing community action teams in terms of referral system. These teams will be able to support us in prevention, response, and also timely reporting of SGBVs in Burat County. Also, we are going to advocate for the influencing policies. Currently, we are working on gender policy that has a 5-year plan and is supposed to end this year. Our main objective is just to identify the gaps and the challenges that the commitment and actions of the policy has not yet been reached, and be able to maybe to table it to the county assembly for them to be able to review it, and also further to adopt it as a gender bill in one of the clause of the policy, particularly the issues of the safe house and the shelter houses for the survivors. It is not yet accomplished in the policy. The issues of rehabilitation center and the issue of a clear referral pathway for survivors to get justice. So those are the issues that we're going to be amplifying through the Prevention and Response Project and Plan International as one of the WLOs.